Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm good, Jared. How are you?
Hanging in there. It's kind of nice out today in Boston. Not too bad. It's going to snow soon, and I'm not a fan of snow whatsoever. So not really looking forward to that. But other than that, just dandy.
Yeah,
What's
well, we're seeing it's in the 30s here in Fort Worth, which is not real common either. So it's pretty cold here. But really appreciate you having me today. I'm delighted to be here.
Yeah, I'm excited. Well, I think we should just dive right into it. I'd love if you could tell the audience a little bit about yourself, and we'll go from there.
Yeah, sure. I'm Luke Hejl. I'm the CEO and co-founder of TimelyMD, and we're the leading telehealth company specializing in higher education. Our mission is something that's really important to us, and it's to improve the well-being of college students by making virtual medical and mental health care accessible anytime, anywhere. So what we do is we build telehealth programs with higher education institutions, really to help students both thrive on and off campus. This is my third startup to lead. Prior to founding TimelyMD, I was at a couple other early stage companies, including Doctors in Training, which is an online medical education company. And then after that, I went to Social Factor and built that company. It's a digital agency, and one of our cornerstones there was healthcare as well. So done a number of things in healthcare. I'm very consumer minded. When I decided to start a telehealth company, I came together with my two other co-founders. We looked at different market segments to identify kind of what the market needed, and we found a significant need within higher education to get both students care quickly and to provide care to students who wouldn't otherwise seek it out. So we're able to impact the core goals of the institution, such as retention and engagement of students in higher ed, and we partner directly with the colleges and universities, providing the access to care for all students on campus. A great student experience is really kind of the foundation of our company. And it ties to one of our core values, which is quality of service here at TimelyMD. And our team takes this core value pretty seriously in everything we do. I guess a little about me personally as well. If I'm not working or with my incredible wife and three kids, I'm probably on the trail. I'm a big endorphin junkie. I love to run. I love to ride my bike. I really love to spend time on my Peloton as well. These things paired with my faith in God fuel me every day in what I do.
Perfect. Yeah, I actually just started getting into the Peloton as well. It's great product. They did a really good job with it. I feel like I've been seeing more and more people. I just use it at the gym, but I've been seeing more and more people like have the delivery truck outside their place, getting one themselves. I think the uncertainty caused by the pandemic, that can I go to a gym or do I even want to go out at all, right, has definitely helped their business a lot, from what I've seen.
Yeah, no doubt. I'm a shareholder. I really love the product. And, when we were told to shelter in place in March, I bought two things immediately. It was a Peloton and a pool heater. So we decided we were going to figure out how to shelter in place pretty well.
Very nice. Yeah. Well, thank you for the intro too. I like the personal touch at the end too. It's really nice to also hear about, when you're working at a startup, when you're running a startup, most of your time is spent on that, but it's always nice to know that when you do have those moments, you're doing something outside of it as well. I'd
Exactly.
love if we could go more into why did you decide to kind of target colleges and universities? What was it about that kind of drew you in?
Well, just to kind of dive into a little bit more about who we are and why we do what we do. So, we're really the only all-in-one telehealth provider created for colleges and universities. We partner with close to 70 campuses across the country, really with the shared goal of helping students be well and thrive in all aspects of their lives. So that's kind of the why, part of the why of what we do. And we're proud to partner with really schools all across the nation, including national research universities like Duke and Emory, Johns Hopkins, and Notre Dame, HBCUs like Paul Quinn College, Claflin University, community colleges like Los Rios Community College, Collin College, liberal arts colleges like Middlebury and Claremont, and of course my beloved alma mater, Abilene Christian University. So all three of my me and my two co-founders, we all three of us went to Abilene Christian and are happy that it's one of our schools as well. One of the things that makes us unique is our ability to kind of become part of the DNA of the campus that we're serving. So for instance, Duke's program is actually branded Blue Devils Care. Notre Dame's program is called Fighting Irish Care. So we work really hard with the institution to create something that's going to bring a lot of value to their students, but also something that's going to resonate with students when they think about the types of care that we provide. So we've got medical providers and counselors available 24/7 in all 50 states. Our providers are trained and passionate about student care. So many times our providers are working with a student who may be talking to a provider for the first time without mom or dad in the room. So it's really important that they think about that and consider that in the way that they deliver the care. Our providers are trained to treat a wide range of medical conditions and mental health needs through our 5 main programs, which include on-demand medical care, immediate mental health support. This is a service that we call Talk Now, scheduled mental health counseling, psychiatry, and health coaching. So on the medical side, a licensed TimelyMD provider would assess the symptoms of a student through a phone and video consult and create a care plan prescribing medication, obviously, if necessary for that student. And then on the behavioral side, students can speak with a mental health provider about anything from general anxiety to relationships to a critical situation. So, they're talking to students everything from, my roommate stole my Cheetos and I have no idea how to handle this situation, to relationship issues, to, situations where they may have something in their hand with intent to harm themselves. So it's a really, a key thing that these institutions are providing for their students. It might be helpful if I walk you through kind of what that experience looks like.
Yeah, that'd be very helpful. Thank you.
So when the student logs in, they just select the care or service that they need, such as medical or Talk Now. And so when they do that, they can see the profiles, faces, and really the basic identifying details of the providers that are available to them. That profile includes things like the clinical interest and experience of the provider. For example, mental health providers with experience or clinical interest in anxiety, grief, LGBTQ plus community, Christian counseling, things like that. That would be really important for a student to find a provider that might best fit them. So they can choose that specific provider. And typically they're speaking with someone within just a few minutes. So for on-demand visits, which would be for us, it's Talk Now and medical, it connects the student with a provider right then to quickly get them the help and advice they need. And then for scheduled visits, the student can schedule counseling out in advance, which also allows them to establish a therapeutic relationship with a specific counselor, which is something that's really important. When you think about that regular cadence of meeting with a counselor, it's important for them to have the ability to see the same one over and over again. And so from a virtual care perspective, that's something that we hold really tight. Health coaching and psychiatry are also scheduled similar to scheduled counseling.
And you mentioned it a little bit earlier, but so what type of healthcare professionals can the student interact with? You said health coaches, counselors, what other types?
Correct. So on the medical side, we've got everything from medical doctors to DOs and NPs and PAs. And then from a mental health perspective, we've got a wide range of mental health providers, including LPCs and a wide range of different mental health providers as well. That they have access to. And then let's see, on the behavioral side as well, we've got psychiatrists that are available to students, and then health coaches as well. So from a health coaching perspective, they could talk to someone, anything from nutrition to sleep habits and things like that.
Yeah, I've seen a really big boom in the growth of mental health providers, whether it's social workers, other therapists, and then health coaches as well. It seems like that space is growing like crazy. So it's great that through TimelyMD, they have all these different options. I think that's important rather than having to go these different, to these different organizations at the same time. That's super helpful. Where can people learn more about TimelyMD?
So, if they want to learn more about TimelyMD, they can go to our website, which is just timely.md. We've got tons of great content there, research and tips on our blog that can help promote student health and well-being. I'd also encourage people to find me on LinkedIn and engage with me. So it's Luke Hejl, Hejl. It's my last name. Then, of course, check out our other TimelyMD social channels.
Perfect. And I will throw all the social links and your website link in the show notes for the audience to be able to easily access. But I'm excited to continue to follow the progress of TimelyMD, stay in touch with you, and wish you the best of luck with everything moving forward.
Thanks for the opportunity, Jared. I've really enjoyed the conversation.
Likewise. Thanks again.